Yeah. Okay. I was waiting for more people here, but I think so. So today is the Medicare meeting, Medicare 26 and beyond. And on behalf of the Wellness Committee, I welcome you all. Before I introduce our speaker, I have three announcements to make. And the first is from our Medicare Fraud Squad. And Nancy Najelski is going to announce some.
Hi, we're not actually a Medicare Fraud Squad. We are just the Fraud Squad. Horizon House is a pilot program that some of us residents are doing as volunteers for AARP. Our goal is to educate residents in how to protect themselves against frauds and scams. You may have seen me at the Residents Council meeting briefly talking about that. But what I want to come today just to briefly mention is that during Medicare open enrollment, frauds and scams greatly increased. Medicare is never going to call you or email you or text you asking for your Medicare number or your bank account number. So if you get a call, a text, or email from anyone asking for that information, hang up, delete the text, the email, and call the insurance commissioner's office. And protect your Medicare card and your Social Security card. Don't keep them in your wallet. That's not where they belong. Keep them in a safe or someplace safe like that on your apartment. Just to give you an example of some of the very common scams that occur during Medicare open enrollment, you'll get a call or maybe an email saying, Medicare is issuing new cards. We need to verify your number so we can send you out that new card. It's a scam. Another common one is someone calling saying you're pre-approved for a cheaper Medicare plan, or maybe you're eligible for a refund on Medicare benefits, or you qualify for free medical supplies. These are scams. Trying to get, again, your Medicare number or your bank account number. Don't provide the information. So above all, remember the 3 R's. We're hoping you'll remember these. Recognize, resist, and report. Thank you, and be safe.
Thanks, Nancy. Good things to remember. So I have 3 announcements before we go to our speaker. First, we have Medicare toolkits, which some of you are looking at right now, I see. And these are provided by SHIBA, and they help with decision making, which will help you lead to sign up for programs. And there are phone numbers, emails. It will provide you with additional information if you need that. There are toolkits in the back, and then there will be some more in the mailroom. The second thing is health insurance open enrollment resource handouts. So these are something that the Wellness Committee put together. Thank you to Barry Eben for being the lead on that. And these have resource lists for not only Medicare, but for the employee, public employee, state employee insurance, the federal insurance, and the military TRICARE insurance. So that has a lot of information and also describes the third point that I want to mention is that we have arranged to have volunteers, SHIBA volunteers, to come to assist in choosing a plan and signing up for that plan. There are 2 dates, this coming Saturday, October 25th, and then the following Saturday, October 1st. And November 1st, thank you. The first one on Saturday, I think, is full. There are a limited number of sign-up times, but there's a wait list, so you could put your name on that if you choose to do so, and there's a chance that you may get one of those appointments. The following week, I think we have 6 open slots. And these signups will be held on Saturday, the 25th. It'll be in the Robert Durham room, and then on the 1st of November, they'll be in the Robert Durham and Myrtle Edwards room. There is also information by Rick Joseph, Rick Joseph is the broker that handles all of the insurance for Horizon House, so he's a very trusted source, and he's volunteered to present some information and guidance for signing up for the state employees, public employees plans, TRICARE, and the federal employees plans. So there's different information involved in that, as you know. And that includes my announcements, and so let's move on to today's program. We have Tim Smolen and also two other people from the SHIBA program, Carol Ann and Sam. And Tim has been our director of SHIBA for a long time. It's your, fourth year here? 4 years. And he is director of the state SHIBA program, which you probably know is an acronym for the State Health Insurance Benefits Advisory. And he'll talk today about Medicare 2026 and what we might expect in the future, which will be difficult. But okay, thank you, Tim. Applause for Tim.
Am I okay for the mic? Yep. It is really sincerely, it's a pleasure to be with you again. As John said, this is kind of a thing I look forward to doing every year. I recognize some folks in the audience that I've seen before, so it's lovely to see you again. It's kind of like my little annual checkup, see how you're doing. You all are doing great, so don't listen to anyone who says otherwise. I think you're doing great. So before I start on my remarks, let me, as John said, let me introduce Sam and Carol Ann, and they can say hello and say what they do in support of the program. And then I'll do a relatively brief program, and then we can have some conversation, questions, and answers.
Hello, everyone. My name is Sam Stones. I'm the regional training consultant for King County at the Office of Insurance Commissioner. We have a really great group of volunteers, and I am the person that trains them on the Medicare so they can counsel everyone. And our group is specific to King County, and so there's a SHIBA program in every county, and I help manage the I help manage the King County group, and I do that in partnership with Carol Ann from Solid Ground. So I'll pass it on to Carol Ann, the volunteer coordinator.
Hi, everyone. Thanks for having us. I'm Carol Ann Smith, the SHIBA program lead at Solid Ground, and I've been in this position since June, so still new. I coordinate our group of lovely SHIBA volunteers who do all the counseling and education, so you might see them around the community giving presentations or on webinars, and also just in one-on-one counseling. I am not quite an expert in Medicare yet, so if you get a call from me, it's just me screening for our SHIBA volunteers, but if you get a chance to talk to them, they'll usually be able to help answer your questions. All right, and I'll pass it back on to Tim.
Thank you. So let's see, by way of context, the way the SHIBA program works is that I'm kind of the, there's like a show pony and a working pony. Like I'm the show pony, and they're like the working pony. So, so the way the program works really is like, as John said, we're going to do this on Saturday. We train individual volunteers in local communities to help people kind of one-on-one, in person or on the telephone to kind of navigate Medicare. So we do a lot of getting started in Medicare, a lot of Medicare open enrollment, and then kind of problem solving around Medicare. And when I tell people what I'm doing, for my work, the two most common questions that I get is, number one, why would anyone do that? Why would anyone be a SHIBA volunteer? And so that's what Carol Ann is for. Carol Ann is the reason that you would be a SHIBA volunteer, because people that do it love it. And if you stay for 6 months or a year, then you're as likely to stay for 5 or 10 or 15 years. And they love it. And lots of them do other volunteer activity besides being a SHIBA volunteer, but this is the thing they find the most challenging and rewarding. So it definitely is kind of a steep learning curve, but once people get into doing it, they just get a tremendous amount of satisfaction out of helping other people navigate through Medicare. And as John said, we will be here Saturday and then Saturday next. We started doing this last year. I came up and did a program like this for you all last year. And Barry and I were talking in the hallway, and he said, is it possible for you guys to come and help out? And John and I would take care of managing all the local arrangements. And it was such a great experience, and we helped a lot of people, and you guys run a very organized effort. So if you haven't already, there's signups, and then there's reminders, and then they're there morning of to check you in, and then they ask you afterwards if you had a good experience. So I'm grateful for all your support, and we're very happy to do this program again. And then for Sam's role, the other common question that I get all the time is like, well, are the volunteers good at it, right? I mean, sometimes it comes out a little bit more coarse than that, but that's kind of what the question is. And it's often like in the context of like compared to my neighbor or compared to an insurance agent. And I say, yes, they're as good as a paid professional, and they're better than your neighbor. Unless you live in my neighborhood, then I'm the best. No one's as good as me. No, I don't really say that. But no, they are very expert, and they also know when they're kind of out of scope or they don't know something, and then Sam takes care of kind of their technical questions, and we have access to experts at Social Security and Medicare and other organizations. So you will be well served by someone who loves doing it. It's not a burden. We want your call. I did a program this morning like this, and I said, it doesn't feel like an entitlement if you don't know how to use it, or at every turn it's frustrating and difficult. But Medicare really is your entitlement, and it's really supposed to be not effortful. So I guess that's what I'm about. Nick, do I have a clicker, or do I just like push the next button here? Right arrow, okay. So this is my personal contact information. I welcome you reaching out to me. I'm happy to hear from you directly. We helped Nancy last year, and then she and I corresponded after the fact. So I'm much better at email than I am at phone calls. Apologies for that. But please do feel free to write to me, and I will write back to you. And if I can't help you directly, then I will find someone who can help you. And Risa, are we going to make the slides available to people that want them after the fact? Okay, I sent it to Nick. So if you're a person that wants to see this slide deck, I'm happy to share it with you. But I did bring you this souvenir packet. So we're going to spend a little bit of time talking about the packet. So so for today, obviously, I want to deliver this program to you. So I want to first describe what I'm hoping you take away from the program. I want to talk about the packet. As John said, it's a little bit of forecasting for what comes next for the Medicare program, which, as John also said, very difficult right now. This administration is very unpredictable, although there is a trajectory that I can talk about. And some of you may be currently enrolled in a Medicare Advantage plan that's not continuing next year. So I want to make sure in particular that we connect with you. So in King County, that would likely to be Kaiser or Community Health Plan Washington. So if you are a person who's affected, you should already have gotten a letter from them. And if you didn't, Carol Ann or Sam or I can check in with you and make sure. And then, as I say, discussions. So we had introductions. Of course, SHIBA is an acronym because we work for state government, and that's what we do, acronyms. So this is, as I said, kind of the work of the program at a high level is to train volunteers, and we do that through the work of local sponsors. So the purple-colored space where you all live here, Horizon House, Solid Ground, and Carol Ann, that's our local sponsor. So they're kind of responsible for what I say, care and feeding of the volunteers, right? So Sam takes care of kind of the technical work, and Carol Ann takes care of the emotional support part of being a volunteer. So it is Medicare open enrollment season. This is day 8, not that I'm counting, but October 15 started the Medicare open enrollment season. And I have confidence that something about your plan that you care about is changing. So this is not like a crock pot, set it and forget it kind of thing. So even if you have very good insurance, like John said, TRICARE for Life, Veterans Administration, if you have a Blue Cross plan from the federal government or uniform medical plan with state government, something is changing. So it really, although it can feel effortful, it's worth paying a little bit of attention to not kind of coast through this and then kind of have a bad surprise in January. And we can help explain what your rights and options are, and we can help you with an appointment either when we're here in the building, or you can call us, and Carol Ann has a long list of community partners, places that we meet out in the community one-on-one with people. So here's what I'm hoping you're going to get out of today's program. Number one, very most important to me, is that you know that I care about you and I will help you. To explain what I just said, it is a good idea to check your insurance and understand whether it's the best value for you, understand what your rights and options are, how to reach us, and then share a little bit about some tools that can be helpful. So this year, which largely comes out of my miserable experience of last year's open enrollment, we have this Jumpstart Toolkit, which I'm going to make you indulge me by opening and going through together, because like that's my prerogative for being here today. I get to make you go through the packet. I won't let you ignore it. So it was a really tough year last year. We had a lot of changes in the Medicare program and a lot of changes in Medicare Advantage plans. And it was very difficult. I was exhausted by the end. And so I said to myself, I took my dog out, Ruben the dog. I took Ruben the dog out for a walk, and I said to myself, I said, we need a better plan. We need a better plan for next year. And so I had the idea that we would create this Medicare Open Enrollment Jumpstart Toolkit to kind of respond to the main places that people get stuck or have problems. And so with tons of support from my public affairs team and a lot of other people, this is a big effort. As much as I would love to take credit for it, I really can't. But I want to just spend a minute and kind of walk you through what we have here. And Carol Ann and Sam customized these a little bit. So on the left-hand side, you've got some Horizon House only materials. So your packet is like a collector's edition. You could put it away in 50 years. It'll be like baseball cards used to be when I was a kid, worth something. But on the left-hand side, Risa, can the camera pick up like that I'm holding something up? So on the left-hand side, first of all, we have this envelope. I wanted this to be about twice as big and bright orange, but I got voted down. But I did manage to negotiate my way into this. So problem number one, in January, I'm going to get hundreds and hundreds of calls from people, and they're going to start with, how come no one told me my insurance was changing? And I'm going to say, gosh, I'm so sorry that happened to you. Is it possible that you got a letter or an email? Nope. Okay, sure. So let's call your insurance company and find out what address they have for you, because they're required to scan all the mail that they send to you, and they're going to find an imaged copy of the letter that they sent to you at your address. So this is not like a blame and shame kind of thing, but I think there's a pretty good chance that something important came and you missed it in kind of the avalanche of mail and solicitations that you got. So I'm going to try to kind of pull you out of the icy water in January, but next year we're going to have an envelope, and you're going to put all your mail in here that looks like it's related to Medicare. And it can be all the advertisements, or it can be anything. But this toolkit is really organized around, number one, you're going to do a better job of self-service, or number two, when you show up on Saturday, you're going to have a better appointment because you're better prepared for the appointment. And that starts with, if you got a letter saying your plan is not continuing next year, shove it in here and bring it with you, right? So big envelope. And then the second principal challenge that we have is that we're going to ask you, Carol Ann, or one of the volunteers is going to ask you, like, what kind of insurance do you have now? And people don't know, which is natural. And so we created this thing that I call like the placemat. Used to get these at Denny's when you went there. And I'm so the inside the building argument about this one, which I won, thankfully, was it has to be the actual size of an actual insurance card. Because, right, so we're state government, and so we're like, but it costs half as much if we print it on a piece of paper this big, and it's going to cost twice as much. And I said in some colorful, Midwestern language, like, I'm not really concerned about how much it costs. It needs to be the size of an actual insurance card. So this is meant to just help you get oriented to the kind of insurance that you have, because a typical thing that happens is either people threw away their cards, or they have all the ones they had since they got a driver's license when they were 16 back in 1947. And so we just say, dump out your purse or dump out your wallet, and we're going to kind of play 52 card pickup and try to make some order out of what kind of insurance you have. So there's like a 100% chance that you have this red, white, and blue Medicare card. And then there's a pretty good chance that you have at least one of these other insurance cards. So this is meant to help kind of get you oriented, because your rights and options and protections for next year start with what do you have today. Does that make sense? Am I making sense so far? Okay. So so then the next thing is from here, I'm going to skip ahead a little bit in your packet. Bear with me. I have another giant size piece of paper. It's not really giant size. It's also a thing about large print, right? We need to print things with bigger print, better contrast, so trying to go that direction. But I'm going to say that in general, there's some exceptions, but in general, you're going to be one of these kinds of people. So I kind of have these 4 personas. So you're a person who has what we would call original Medicare, or you're a person who has a Medicare Advantage plan, or you're a person who has insurance from the place you used to work at, right? So you used to work in the federal government, and so you have insurance from the job you used to have in the federal government. Or you have Apple Health or Medicaid, right? So you qualify by having very low income for the state to take care of your insurance. So you have a red, white, and blue card, and then you also relate to one of these 4 kinds of personas. And then for each of those, we're going to say, if you're this kind of person, your rights and options for next year is like this or like this. So option A, option B. Does that make sense? That's kind of how the packet is organized to help. As I say, you might just be able to, from this, do everything that you need to do. Or it might just help set you up for a better appointment, whether that's with a SHIBA volunteer or an insurance agent, if you're going to call 1-800-MEDICARE, or if you're going to call the health plan. We feel like, we hope, it's still early, right? We don't have a lot of like field test experience, but we're hoping this will help people either navigate independently, or it can help you just be better prepared when you start having those conversations. Another one of those kind of internal, inside the bureaucracy kind of conversations. This one we have, it's too soon to say, but I was very strong on putting a QR code on these. And this is one of the fun, I really love my job. I have a fun job. And one of the fun things about my job is how often I hear people say things like, old people will, or old people won't, right? And I just love that. I'm like, am I old? Because I was saying to John when I came in, I said, like, I spend half my life with people that are older than me and half my life with people that are younger than me. So I'm not sure how to think about I'll be 63 in April. I'm not sure how to think about my own age. But I'm confident that you all are going to take out your phone and scan that QR code, and it's going to land you on our little Medicare website, and you're going to find it useful, because I think you are living along with the rest of us in this kind of age of smartphones and digital technology. So we'll see. We'll see what it's like an experiment to see what happens, right? The people who run our website can track how many people scanned that code that's in the packet, so we can get some feedback about whether this was a good idea or not. I will try to have humility when I'm right and not gloat about it, but it's going to be super difficult. Honestly, it is. It's not my best thing. I'll just acknowledge that by way of like a pre-confession. And then the last thing that was very important to me to put in the packet is the last page on the right-hand side is a review. There are these programs for people that have low income that they can get some extra financial support from the state. And, sadly, well, I guess there's like two sadnesses joined together here. So the first sadness is that this is the 60th anniversary of the Medicare program. Back in 1965, Lyndon Johnson, as part of his Great Society effort, created the Medicare program. And it's just very difficult for me that we're not celebrating that the way that I feel like we should be, right? This administration just doesn't care about it the way that I care about it, which this is not an isolated example of that, by the way. But it's just very difficult for me because the program is so very successful. And, Lyndon Johnson's motivation for the Medicare program came out of his work with poor people in the Texas Hill Country. He was a congressman and a senator before he became president from Texas. And his goal was that we were going to help older people not become impoverished when they needed to go to the hospital. So it was really like an anti-poverty program. And it has worked fabulously. I mean, the fact that we have the Medicare program and it is essentially universal health care for older people has meant that it's just been life-changing for people. But unfortunately, especially in the last decade, we've gone back a lot. So now, and I'm very sad to say this, but the fastest growing part of the population of poor people is old people. More old people are becoming poor all the time. And they're also, again, very sadly for me, the fastest growing part of the homeless population. And I don't even know how to talk about that. It just is like amazing to me. So the point is that there's just lots and lots of people who are really struggling. The Medicare Part B premium next year is going to go from about $185 a month to $200 a month. And there are lots of people who cannot afford that. They can't afford the $185 and they can't afford the $200. And so the last page in here is just to say, this may not be you, but you might be able to help find someone who needs to know about this and help them get signed up, because the state can pay that $200 a month. And then they can have that $200 to make their rent or to make their food or to take care of something else that's very important to them. So there's your orientation to the packet. So quick review, right, about Medicare. Medicare is insurance. Insurance is a contract. What you have to know about Medicare in general is, and again, this was by design, it's a major medical program. So it doesn't pay for everything you need. When it does pay, it doesn't pay 100%. And so it's just important to you to understand, what is Medicare going to take care of? And if you have other insurance, what is that going to take care of? Because that's just generally how it works. So as I say, you probably all have your red, white, and blue Medicare card. It looks something like that. But you're going to need some other insurance because it's not comprehensive insurance, right? And I understand why people want to kind of assail the Medicare program and say the Medicare program should be modernized and the Medicare program should include vision, dental, hearing, other benefits. But it was by design, right? It was what the Congress and the administration 60 years ago could agree on. It looked like every other kind of modern insurance at the time. This is the kind of insurance you had if you had a job that had insurance. And there just is not the public will to continue to invest in the Medicare program. So we have the advent of other insurances that complement your Medicare insurance. So for the most part, now I'm going to leave out Medicaid for a minute, but you either are going to have a Medicare supplement plan, that's my persona number 1. You're going to have a Medicare Advantage plan, that's my persona number 2, or you're going to have insurance from the place you used to work at. That's my persona number 3. So I've showed you this slide before. If you don't remember, that's okay. But what I'm trying to represent here, Nick, I'm going to go off camera for a second, is that for most of the history of the Medicare program, we had this relationship. So when I talk about like original Medicare or traditional Medicare, you will also hear me refer to it as fee-for-service Medicare. There's a direct contract between the providers and the Medicare agency. So we talk about like the Medicare fee schedule. So what does Medicare pay for a hospital bill? Whatever Medicare decides, Medicare pays. What does Medicare pay for a doctor visit? Whatever Medicare decides they're going to pay. So about half of you all have this kind of insurance, original Medicare. The other half of you all, apologies, Risa, have this kind of insurance that I'm going to call Medicare Advantage. This is relatively new. For most of the Medicare program, we did not have this, but it's the fastest growing part of the Medicare program. So over time, we've seen people move from this arrangement to this arrangement, and it's largely because these plans are more affordable. And they do include extra benefits that are not part of the original Medicare program. So I'm talking about vision, dental, hearing, over-the-counter food card, transportation, right? And what you need to know here is that there's not a direct contract between the providers and the federal government. We have an insurance company that intervenes in that relationship. Most of these are for-profit businesses. So you will be familiar with this expression about like privatizing Medicare. And that's the concern that people have, is that companies like United Healthcare are getting paid by the government and then contracting with providers. And this is partly why we have this annual exercise about turnover, right? So last year we had tons of drama when I came to see you all about Regents is not going to do certain counties. Primera is not going to offer this insurance in Washington State anymore because they decided that it was no longer a good business decision for them. And so, as with Medicare Advantage, prescription drug benefits are not part of original Medicare, so they are private contracts between a private company and the federal government. So you just have to know that it's a very different kind of arrangement with very different kinds of incentives. And that explains a lot about where we're at, and this is like foreshadowing, this is where we're going. We're going to see a continued migration of people this direction. And it's a bit like inexorable, right? But I'll talk some more about that. So first kind of classic arrangement, you have your red, white, and blue Medicare card, you have a Medicare supplement plan, and you have a Medicare prescription drug plan. So essentially you have 3 insurance cards that you're packing around. And this model is very popular with people because it represents essentially freedom of choosing providers. People like the Medicare supplement plan because any doctor that contracts with Medicare, you can see them. There's no prior authorization. There's no referral to a specialist, right? The downside is that they're relatively more expensive. So in the current market, like a good quality Medicare supplement plan is going to be about $250 a month. And that number is going up steadily, right? We've seen in the past 3 or 4 years, it's gone up 5 or 8 or 10% every year, and that's likely to continue. And so that just puts a kind of price pressure on people who say, I would prefer to stay here, but it's becoming increasingly unaffordable to me. And there is, again, that kind of lure of these extra benefits. And so that's why we see this like migration, right? Because Medicare doesn't pay for prescription drugs, Medicare supplement plans don't pay for prescription drugs because they just pay the part of the bill that Medicare doesn't pay 100%. So most of you all who have this arrangement also have a Medicare Part D plan. The point, again, is that these are an annual contract between your pharmacy benefit insurance and Medicare. So if you have WellCare, it's probably working great for you, and it absolutely is worth checking to make sure it's the best one for next year. Because as I said at the outset, I can assure you something that you care about is changing. So it's going to be the premium or it's going to be the list of covered drugs, or it's going to be the network of pharmacies, or it's going to be how they manage tier 1 compared to tier 2 compared to tier 3, 4, 5, right? Something is changing, and it's worth just not being surprised when you go to the pharmacy on January 2nd and they say $13, and you say, last year it was for free, and they say, yeah, things changed. Like, don't set yourself up for that, right? Okay. Then about half of you all are on this side of the world where you have a Medicare Advantage plan. Things are even more likely to change on that side of the world, right? Because again, they have a contract with you. They also have a contract with the federal government. And so there's this constant tension between the private insurance company and the Medicare agency about how much money can I get? How much money do you need? What am I willing to offer? What am I willing to pay for, right? So we have this tension every year that when the dust settles, so to speak, your contract is different. We used to do this, and now we do this. So it's just really worthwhile, again, acknowledging it's effortful, but it's worthwhile to just spend some time and make sure that you're not surprised about what's coming next. I'm going to skip ahead a little bit. This is our website. It's kind of all over the packet. You'll see that I did not put our phone number in the packet because last year we had a miserable experience. I had a miserable experience. We had so many phone calls that we could not answer and get back to people. It was very upsetting to me. So this year, no phone numbers because we're trying to manage the traffic better. But you can call me. But we have a great, email's better though. We have a great website, and we have lots of good information about Medicare supplement plans and Medicare Part D plans. What I would want you to know about Medicare supplement plans is be pocketbook loyal, not company loyal. Just because you feel like State Farm has been a great company for all these years, you do not owe them your loyalty. Take a look around. There's lots of companies that offer identical insurance. Choose the one that's the best for you financially because it's a standard benefit design, right? So, you know, they're counting on you to just continue your renewal every year, year over year. But it's worth taking a look around. You can make a change to your Medicare supplement plan anytime during the year, inside or outside open enrollment. So it's just worth taking a look. And again, we have really good resources for you to do that. For Medicare Part D plans, again, these are sold by private companies that contract with Medicare. Your principal concerns are going to be about the list of covered drugs and the network of pharmacies. Again, same for Medicare Advantage plans. You're going to be concerned about beyond the premium because they're virtually all $0. How about the provider network? Which doctors, which hospitals? We had the unfortunate experience here last year that a lot of you got a very threatening letter from United Healthcare saying, we don't want to contract with VM next year. And of course, eventually it got settled, but it was very disturbing for a long time. So please pay attention. Medicare Advantage plans, Medicare Part D plans, your good tool is the Medicare website. I know some of you don't love using the website. A SHIBA volunteer can help you with that. But there's going to be, Sam, like 50 Medicare Advantage plans in King County for next year. So you're not going to get a piece of paper and make a chart and go through them. You're going to have technology. Okay, so I'm kind of wrapping up here, heading to questions. Figure out what kind of insurance you have. Make sure you know what's changing. The company owes you an annual notice of change. If you didn't get one, you can call the number on the back of your card and ask for one. If you're a person who is losing your plan, you can change insurance and you have certain extra protections. So I want to talk about this for just a second. We have this thing called special enrollment period and guaranteed issue rights. So if you got a letter, if you're one of those people who got a letter, I'm thinking about Kaiser, Community Health Plan Washington, Aetna, your plan is not continuing for next year. You can choose obviously a different Medicare Advantage plan, or you can switch to a Medicare supplement plan, and they cannot turn you down, and there cannot be a waiting period for a pre-existing condition. So I'm doing that thing again where I'm saying this might not be you, but you might know someone that you're going to encounter, and they're going to say, I got a really threatening letter, and you can say, I know how to get you some help. Let me get you one of these packets that Horizon House has, and let me connect you to a SHIBA volunteer. And so with that, let me just, did Carol take off already? That was a great pitch about fraud. We also are very concerned about fraud in the Medicare program. We run a program called the Senior Medicare Patrol. So you obviously start with Carol, but you can call us if you feel like something untoward happened. Medicare is complicated. You should consider being a SHIBA volunteer. They live longer. They live healthier. They live happier lives. I have lots of evidence to prove it. And if you have a concern that's not about Medicare or not about health insurance, the Insurance Commissioner's Office is a full-service program. This is how you get a hold of Sam, who's here in the front row with me, and this is how you get a hold of Carol Ann. If you want to get an appointment, Carol Ann prefers that you don't write to her, that you write to this mailbox that the volunteers keep track of. Okay, with that, I'm going to ask about questions and answers or some discussion. And because this is my 4th time here, I just went ahead and helped myself to coffee because now I know where it is. Yes?
Okay, so you say that Medicare Advantage is not going to be covered by Kaiser? Can you wait for the microphone? Yeah.
Ask it again.
Okay, so Medicare Advantage is no longer going to be available through Kaiser? I thought that's all they did.
Mm-hmm. Did everybody hear the question? Are you leaving, Marianne? No, you're working the microphone. You're working that half of the room. You guys have like divided the space. I see what we got going on here. Okay, so I'm not going to make you take out your packet again, but important distinction will be some of you might have Kaiser from your job, and some of you might have Kaiser not from your job. So if you're, for instance, retired from the state of Washington, you might have Kaiser as an HCA PEB retiree. That's different than Kaiser for people that bought it outside of their job. So Kaiser outside of their job, and Sam, I'm going to get the numbers wrong, but they maybe used to have 10 plans in King County, and now they're only going to have 6. So what may be happening is that 4, thank you. 5 to 4 in King County, and it's different in different counties around. So they're not, there's no place that they're leaving altogether, but you may have got a letter saying you're currently enrolled in plan H001. We're not offering that one anymore, but consider H002. It's almost the same thing. Can I say that? Yeah. Is that helpful?
Yeah.
Yeah, but you're right. That's all they do. And people, feel differently about Kaiser, right? Because it was group health before it was Kaiser, and it does not have that same kind of for-profit motivation, right? And so people kind of have a different space in their heart for Kaiser than they do other kinds of Medicare Advantage plans. And it is a very different model, for sure. Hey, Carol.
Gene?
Jean? Jim, are you coming back?
Yes.
Right
Good.
behind you.
Who had a question?
Yes, I'm a bit puzzled about my United Healthcare. I've had it for years, ever since Medicare. And I don't know when it happened, but on my card, it's printed MedAdvan, ADV. And yet, I've not ever called them because there's never been a question about which doctor I saw or anything about any procedure, no referrals, no problems. So why is that on there, and am I Medicare Advantage?
We could for sure take a look at your card, but I'm going to say yes, it's almost for sure that you have Medicare Advantage. And there's just lots and lots of publicity all the time, right, about sort of horror stories about Medicare Advantage and United Healthcare. But the reality is people who have Medicare Advantage plans compared to original Medicare, they're just as happy. They like their plans just as much, and they feel like the service is just as good. So, a lot of this is a case of kind of, it grabs headlines, but if you're happy with it now, you're likely to be happy with it forever. If you're going to have a problem, it would happen right away.
My premium keeps going up. My premium is about what you mentioned it was, and you intimated that at Medicare Advantage premium is less.
Yep. So then, again, I would want to maybe sit with you and look at your card, or Sam could, but my hunch is that you might have United Healthcare maybe from a place you used to work at, like as part of your retiree plan. Nope. Then I think I'm surprised if you're paying that much. So it's easy enough. What we would do is go to the Medicare website. We would look up the plan you have, and then we would look up any other United Healthcare plans in King County or in Seattle where you could keep your doctor in your hospital and check for your prescription drugs. So maybe like 45 minutes to kind of walk through a review like that.
I'm on the list.
Are you signed up for Saturday this or Saturday next? Okay. And Carolyn, how many volunteers have we got coming? Yeah. Okay. And like we have appointments on the hour kind of thing? Mm-hmm.
Yeah, on this coming Saturday, I believe we just have the 2 volunteers. And then the next Saturday, we have 4 volunteers, and they're scheduled for an hour. But I think that if people get on the waiting list, they'll be able to get also see a counselor, because some of these appointments are not going to take an hour. So there'll be some time for more than just an hour.
I'm drinking this strawberry banana smoothie. Have any of you eaten in the snack shop? You don't have any junk food. There's only healthy food. I was going to get like a bag of Cheetos or something. No way. Not here. Where are we going, Jim?
I don't know. Other questions?
Yeah. So my impression is that the trajectory, as you intimated, is towards Medicare Advantage.
It is.
And it seems like Medicare Advantage plans are offering more for less right now, but it almost seems to me like that's a loss leader. But in the future, is competition in the market going to keep that premium down?
That is a great question. Nick, was that some kind of a sign?
It's been happening.
Okay.
For a while. It's automated.
All right. Yeah, so maybe we could just talk for a few minutes, kind of like where are we at, where are we going? Let me just think how to get oriented here. So when we initiated the Medicare program, 1965, again, it was really modeled after the insurance that was current at the time, and the leading kind of insurance that was out there had been initiated by a bunch of school teachers in Texas, and at the time we had Blue Cross plans, and that was for hospital insurance, and we had Blue Shield plans, and that was for medical insurance. So we literally had a whole insurance industry for hospital care and another whole one for medical care. And that's why you have Medicare Part A hospital and Medicare Part B medical. Medicare Part B was always going to be voluntary insurance. The government was not going to compel you to buy Medicare Part B, because at the time, you really didn't need insurance to go to the doctor. It didn't cost anything. It wasn't as expensive as hospital insurance. So the thinking was, we're going to basically model Medicare Part A after Social Security. So when you're working, like me, you have a payroll deduction that gets invested in the Medicare Part A trust fund, so that when I get to be age 65, I will not have a premium for Medicare Part A because I essentially prepaid for it. But it was understood from the beginning, of course, again, this is 60 years ago, right? So when we started the Medicare program, the Medicare Part B premium was $3 per month, right? And remember I said a few minutes ago, in January, $200 a month, okay? So you can just kind of trace a straight line and think what happens to the $200, it's just gonna keep going up, right? So the currently then, 2 concerns about the future of Medicare that you'll hear about. Maybe I wish you would hear about it more. I don't love, obviously, I feel like this administration could be a little bit more forthcoming about the kind of their plans for the Medicare program. But the Medicare Trust Fund, the challenge is going to be that there are more older people, relatively speaking, than there is younger people, right? And so at some point, there's not going to be enough contributions from people like me working for a living to pay people like John who have retired. And so we're going to see this pressure on the Medicare Part A trust fund, which is going to have to get resolved one way or another, which either means raise taxes on me, which, you know, in general, people like me resent that, or reduce benefits for you, which people like you resent that. So we're going to have this kind of dynamic tension, right? And that's going to play out like in the next 10 years. That's a short-term concern. The funding for Medicare Part B, again, since the beginning, has been done differently. So Medicare Part B is pay as you go. So what happens is the actuaries at Medicare create a forecast and they say, how much are Medicare Part B services going to cost in the year ahead? And then they divide by the number of beneficiaries, right? It's a forecast. How many people will be enrolled in Medicare Part B in the year ahead? And then we say the government will pay 3/4 and John will pay 1/4. So John's $200 is being matched by $600 from the federal government. And again, we're going to have this problem where John resents the premium going up every year, but also the government is going to start to say, wow, we're spending a lot of money on that Medicare Part B premium, right? Because the statutory language about this is the government pays 3/4, you pay 1/4. And so you're going to keep saying, like, how about let's slow that down? And they're going to be saying the same thing on their side. But remember, this is the principal part of physician income is Medicare Part B. So they don't want a reduction in the fees to them, right? So we have this dramatic tension about what are we going to do about Medicare Part B. Now, the good news is it is literally an entitlement. So we don't have to vote on it every year to authorize spending. We just take the money out of the Treasury. But at some point, we just crested $38 trillion in debt. So, right, that's going to put upward pressure on interest rates, which is not good, right, for the economy. So you have both of those things are a big part of what's behind the continued growth of Medicare Advantage plans, because from the government's perspective, it's a fixed cost, right? They can just decide, we're going to give United Healthcare this much money next year, period, end of sentence. They're out of the business of the risk of it. As long as United Healthcare can get enough doctors and hospitals to take the rate that United Healthcare wants to offer, and that they can continue to make the stock attractive to their investors. So what you're seeing right now, what you're going to see for the next couple of years, is this kind of push-pull between the big insurance companies like United Healthcare and the big provider groups like Virginia Mason and Franciscan and Multicare and Providence, right, where they're going to be saying nurses need raises, and United Healthcare is going to say, we only got this much money from the government, and the government's going to say, we only have this much money to give. And so there's just going to be this tension, right? And so it's going to be higher premiums, less benefits, more payments from the doctors, more payments to the doctors, more money from the government, but it's not sustainable. So at some point, people like me are going to pay more taxes, or people like you are going to get fewer benefits. But in the meantime, it's going to get litigated through this migration of people into Medicare Advantage plans. So I would say we're sitting on, what, like 52% or so? I would say, I would bet you a cup of coffee that we get to 62% in the next 3 or 4 years.
But one of the issues is the for-profit. United Healthcare is for-profit. Humana is for-profit. And so the demand is for them to make more profit and to cut benefits, put up more restrictions.
Absolutely. That's exactly what's happening, right? And that's 100% what's happening, right? CVS, which you think of as like your drugstore, owns the insurance company Aetna. And so you're seeing that like vertical integration. And then this direction, you're seeing like United Healthcare owns Optum, which buys Polyclinic, right? So literally now those doctors who used to be independent contractors now are employees of the clinic, which is owned by Optum, which is owned by United Healthcare. So you see this consolidation, this direction and this direction, both. So it's as if we have the providers and the insurance companies each trying to get some leverage. And yeah, there definitely is pressure from the investors. If you're United Healthcare, if you're Aetna, Humana, that pressure is real. So, right, it just kind of rolls up, right, to the government. But when it lands at Secretary Kennedy's desk or the president's desk, it's tough to justify, right? The good news is you're an organized constituency and you vote, right? But it's hard. I mean, it's gonna be hard for a while, but in the short term, you're just gonna see more of the kind of drama that none of you like, that we're trying to help you navigate through. So it's not, in the short term, it's just going to be, and I think we've talked about this before when I've come to see you all, like it's just like we're in that kind of whitewater space. There's just a lot of turbulence.
Tim, we have a question from the lounge.
Excellent. Go ahead, Barry.
Question is, are there any Medicare Advantage plans other than Kaiser? You've only mentioned Point.
I'm having a little bit of an interesting experience here. First, the lights went out, and then I just heard like the disembodied voice of Barry, and I'm wondering, is there a significance to this that I should be paying attention to?
Yeah. Okay.
Have I made a spiritual transition that I'm not aware of?
He's in the lounge.
He's in the lounge.
Yeah.
Yes, there are lots of Medicare Advantage or managed care plans besides Kaiser. And what we would encourage you to do is find the best one for you, considering doctors, hospitals, prescription drugs, and what you can afford to pay out of your own pocket for copays, deductibles when you go to the doctor's office. But there's lots of options, and it's relatively simple to change from one to another. And you can do that change every year during the open enrollment, and any of our SHIBA volunteers would be happy to help you with that.
Where do you find that information?
Is that from the lounge?
That's from the lounge.
Where do you find that information? So the Medicare website is the best resource, and that is www.medicare.gov. And you can also use our website, which is insurance.wa.gov, or you can call us at 1-800-562-6900. Thank you for asking.
Any other questions?
Yes. Should we be thinking of buying stock in United Healthcare?
Yeah. Well, yeah, that's an interesting question. I think I would invest in West Tower, John. I think the future for West Tower is bright. United Healthcare, I don't know. I mean, there's going to be a reckoning, right? I mean, the path that we're on is not sustainable. I mean, I guess what I'm telling you in terms of prognosticating is something has to give. Where we're at is not sustainable. So I would say this is just kind of a large-scale experiment that we're all living through, but this is not a durable solution.
You think there's any likelihood that payroll taxes the cap on those will increase for people that make more than whatever the cap is, $165,000 a year or something like that?
No.
Rich
I don't
people
think so.
don't want to pay payroll taxes.
I mean, I think there's, Bill Gates Sr. Was a strong advocate for increasing taxes or, estate taxes, payroll taxes. But no, I think by and large, the expression that I would use would be like the investor class, they're not interested in higher taxes. And I think that that's too bad. My wife, I love my wife. My wife is Stephanie. And periodically I just kind of lose my patience, to be honest. And I'll just say, in like one lifetime, in my lifetime, I'm 63 years old in April, I remember when Mitt Romney wanted to be president, right? He was running American Motor Company, and he wanted to be president. And at the time, the corporate tax rate in America was 45%. And that made perfect sense to him. He wasn't saying, let's lower that. His vision for being president was nothing about affecting the corporate tax rate. It made sense to him that's what we did. And how did we get to here? I don't know. I mean, it's a disappointment to me that we don't have that ethic more of, like, of course you should take care of yourself, but at some point you say, are you also okay? I think we've lost a bit of that spirit of sort of shared sacrifice. I mean, I'm hopeful that we can like go trend back that direction, but it's just remarkable to me how quickly we got from there to here. Yeah, so no, I don't see us, John's question was more about Social Security, which also has its own challenges in terms of funding the Social Security Trust Fund. I think ironically the challenges in the Medicare Trust Fund are more pressing, although they get less attention. But I think they're going to be equally thorny to resolve. But that's the answer to both. It's very straightforward. But I don't think there's the political will to do it. Certainly not in this administration. Yeah. I'm having, we're friends, so I feel like I can talk freely with you. I'm having a little bit of a personal challenge here because there's a gentleman in the front row that I have seen before, and I don't want to embarrass myself, but is your name Glenn? Sam, thank you. Darn it. Good to see you, Sam. Do you have a question? You usually have a good question.
That you don't hear much about it now, but when the Medicare Advantage system got started, shortly after, it was clear because the health insurance industry talked about, we need to do this, and when we get enough, we can override Obamacare. And we can get rid of Obamacare because they won't be able to do it the way we will. But the kind of health care they're doing will be have lots of problems in it. So here in Seattle, one hospital went with that and closed down. The name of the hospital is, you'll remember it, I won't. Okay. And it housed itself now in north here, up in Everett, I think. And promptly, I think 12 to 25 physicians quit in a rebellion against, this is not why I became a doctor, to make the company rich. And so my question is, isn't that still very much in the air and a concern, and you don't hear anything about it because the insurance companies finally got, why are we telling them what we're doing, right?
Yeah, so I think, we have a few minutes to talk, so I'll say, again, like, from a historical perspective, something like managed care plans goes back to President Nixon's administration. We had this thing called HMOs, health maintenance organizations, and President Nixon's staff talked him into the idea that it would be a good idea to incentivize the insurance companies to offer these prepaid health plans. Now, it didn't really move the needle very much in terms of Medicare, but it was kind of an early realization that it was unsustainable in its current form. Really, the most significant thing that happened to kind of move us to closer to where we were at came out of President Clinton's administration when we passed the Balanced Budget Act 1997. And that really, at the time, before we called them Medicare Advantage plans, we called them Medicare Plus Choice plans. And, ironically, it was similar to kind of where we started the Medicare program. It was as if saying, look, private employers are saving a lot of money by implementing managed care provisions. And so this was essentially the federal government saying, we could, in Medicare, do what big employers, say General Motors, IBM, they've adopted things like restrictive provider networks or prior authorizations, right? Or capitation arrangement where doctors, you push the risk off of the insurance company onto the providers. And it was really, that was probably the significant push towards where we're at now. And it really was the government responding to how much Medicare was costing and having this annual kind of argument between the Congress and the American Medical Association about the Medicare fee schedule. So this was the government kind of saying like, well, we can get ahead of this by just saying we're going to, and you could sort of defend it by saying we're doing what private industry does. Isn't that what people want? Like make government work more like the private sector. And so that is a lot about how we got to here. And, again, I don't see that thinking changing in the short term. So I think we all have to adapt to that reality that in a way, the government heard our concerns, but they maybe misinterpreted. But now we're kind of, that's the trajectory that we're on. Thank you, Sam. It's really good to see you. I thought my hair looked really good. Look at her hair.
You could do it. I'm with United Healthcare, Medicare Advantage, and since Optum took over, there have been changes. Is Optum connected with any other, like Humana, Aetna, or is it just United Healthcare?
Will you tell us your name? We met last year, Carol. It's coming back to me now. Yes. So the question was about, does Optum work with other insurance companies besides United Healthcare? A little bit yes, a little bit no. So Optum is owned by United Healthcare, so there is a kind of like subsidiary relationship, but Optum really is also like a broker of what I would call like back office insurance functions, right? So they manage things like billing and credentialing and revenue cycle. So they do contract with other large multi-specialty practices that are not related to Optum, but principally they work for United Healthcare. So in effect, it's like they're making a mountain of money for United Healthcare, but they also make money for United Healthcare through other contract arrangements.
I have Humana, and Polyclinic or Optum takes my Humana.
Yes. Yeah, so essentially Humana is also buying services from Optum, but essentially, I mean, I guess United Healthcare is buying services from Optum, but as a subsidiary compared to a contractor.
Okay. We done?
I can talk a long time about this, Jim. Just a long time.
I could just like to say something. So we've learned something about the Medicare toolkits, and Tim's answered a lot of our questions. I think the people that aren't here, though, perhaps they're the ones who need this information the most. So I would urge each of you to be inquisitive about how other, what the understanding of it is amongst your neighbors. Be available to help them or direct them to the toolkits or to the websites, the scan codes, or the phone numbers to call SHIBA.
I tried watching on 370 and there wasn't sound.
Okay, I don't know why that was. Maybe we could find out by the IT people here how to solve that one if there is a solution.
Hey, John. This is Nick, by the way, in the back. There wasn't sound at the beginning because it started a little bit early, but we assure you the recording has all the sound baked into it, so.
Here we go. Thank you, Tim. I found it very informative, and appreciate all the time you put into this, and to Sam and Carol Ann for coming today. I think the SHIBA program is really good, and we're fortunate to have it. So, hope you get here next year. Okay. Thank you.